Okay, thank you. Welcome, everybody, and thank you for coming to this session and making the hike up to the satellite. We're delighted to see you. My name is Keiji Fukuda. I'm a physician by training, but I spent most of my life in public health. And so I've worked in the US and in Europe, and then came to Hong Kong a few years ago to the university, to the School of Public Health. And in this session, as you know, we're going to be talking about the impact of digital healthcare, or the impact of digital technology on healthcare. And to help us go through some of the issues and to really gain an in-depth perspective on this, we have a fantastic panel. And I'm going to ask them to introduce themselves, but we have Barbara Meynert, we have Jeff Chen, and we have Husein Reka. And so, Barbara, maybe just to give a word about yourself.
Good afternoon, ladies and gentlemen. Nice to see you all here. I work for the Fung Group. I'm their senior advisor. My interest in healthcare began at the personal level. You know, I asked myself, as one ages, how does one make sure that my life would not only be, I don't even live longer, but I will live better, I will live well longer. So from that interest, it goes into the bigger issue of the aging society. How much of my experience can be extrapolated to the aging society? Then it moves on to, with the Sustainable Development Agenda, how does it make it cover the rest of the population? So that's the background to what I'll be speaking a bit later.
Good afternoon, everyone. My name is Jeff. I'm the Group Chief Innovation Officer for Fullerton Health. I joined the company earlier this year, and prior to that, I was the Chief Strategy Officer at WeDoctor, one of the largest digital health player in China. My mandate at Fullerton really to take, which is a more traditional offline healthcare services. How can we think about applying technology, the internet, digitalization to make the service more efficient, effective, and ultimately better user patient experience. So we're happy to share that as we go through this whole panel as well.
Good afternoon. Good afternoon. I'm Hussein. I'm a pharmacist by vocation, but most of the time during my 20 years of career, I've been working on health system reforms from health economics and health policy perspective. And the past 12 years, I've been involved in major reform processes in three Middle Eastern countries in the Gulf as part of their visions to diversify the economy, moving from oil and gas-based economy to knowledge-based economy, and healthcare is a major component of this transformation. So I was specifically involved in healthcare financing reforms, and then of course technology and digitalization is a major enabler. And I realized through this journey that it's easier said than done when it comes to technology in healthcare, because things are more complicated there than in the other sectors. So I will be more than happy to share some of these insights and experiences during this journey. Thank you.
Okay, great. And for everyone in the audience, I think the best part of any panel discussion is when it gets opened up to the audience. So we'll definitely save time for that. The plenary goes back into session at 4:15. And so I think that this session will have to end about 4:10, and so I'll keep us on time for that. Now, as you know, there has been a huge amount of excitement, but also concern about the potential for digital technology to transform health. And so I've asked the panel to think about two aspects of this. What do they really see as the major benefits? Where are we really going to see gains beyond where we are now? But on the flip side, the second question we're going to come back to is, what are the concerns that we can foresee? And perhaps most importantly, what is it that we're going to be able to do to address those concerns before they are too mature? And so let's start with the first question. So maybe, Barbara, if I can ask you to start us off.
Yeah, let me pick up from where I left off about the Sustainable Development Agenda. You know, why I bring this up and why I think it's so important. is not only because that these have the ingredients for sustainable development, but it is actually the only global social contract that we have today, with so many of our other social contracts being fragmented and torn apart. This was an agreement that all the countries in the world came to in 2015, only 4 years ago, but the world has changed so much since then. Goal number 3 says that goal number 3 is to promote health and well-being for all at all ages. If I translate that into maybe more common usage, it is what we would call a universal health coverage, which, according to the World Health Organization, is the access to healthcare services, to the kind of healthcare services that when people need, where the people need, without doing financial damage to themselves. And the information is not very encouraging. At the moment, more than half of the world's 7.5 billion people do not have access to adequate health care. And every year, more than 100 million people get into financial hardship, in fact, to extreme poverty, because of the payment they have to make with regard to their own health care. So my support and my other interest is in the digital revolution and how digital technologies are transforming not just any particular sector of society, but the whole society. In other words, there's a whole shift in paradigm. If this paradigm is the industrial economy, in my view, the digital revolution is not shifting and changing a few items in this paradigm, but it's moving. In fact, there's a whole shift to another paradigm. So we're talking about a new paradigm here, which is the digital economy. And it is in this context of this new paradigm, and only in this context of the new paradigm, that I think digital technologies can deliver the SDG 3, which is healthcare for all, or the universal healthcare coverage. Because right now, the cost involved of healthcare is so phenomenal. Let me just give you 2 numbers because of the magnitude of the numbers. In America, is an issue of the presidential election, and Elizabeth Warren has just given a number that if she goes for healthcare for all, which is her main political slogan, it's going to cost $20 trillion over the next decade. And in order to fund it, she would have to tax the wealthy. Now, that alone was sufficient to prompt Bloomberg to enter the presidential race. I mean, so the implication for healthcare for all is phenomenal. We also saw that in the UK. The rate bus going 350 million pounds a week more if we leave the EU had prompted so many people to vote for Brexit. And just yesterday, Jeremy Corbyn came out and saying Labour was going to make sure that the National Health Service would get 29 billion pounds more. That's an attempt to get votes. So I just want to highlight how important national health care universal coverage is for countries where we have, which are undergoing tremendous political transformation and fragmentation. So but because what healthcare can do is lowering costs at all levels, because I think you were asking me earlier, which aspects can healthcare improve? And I think in this new paradigm, it improves every aspect of healthcare. In fact, it's only with the digital technologies that we can achieve universal healthcare coverage, or the Sustainable Development Goal 3. And I'll just highlight maybe a couple of points. One, it gives better diagnosis. Again, just 2 very simple examples. very well-known examples. One is at the Moorfield Hospital in the UK, where they did experiment with Google Health for the past DeepMind for the past several years, where they do diagnosis on AI, and every single case, AI made a better diagnosis than the top eye experts. In China, last year, there was a TV show where they have the top physicians in China, 20-something of them, and an AI machine, and then they show x-rays of tumors. Again, the AI won in every single case. So you have better diagnosis, you have better treatment because it can be targeted, and you also can have better monitoring, particularly in medication management. So I'm not even talking about the cost and the discovery of drugs, which is also cheaper, better, faster with digital technologies. I'm not even going to talk about the operations and administrations of hospitals and all healthcare services, about data and so forth. So not talking about telemedicine, long distance. So in every aspect, we need digital technologies to make healthcare available for all. And I'm emphasizing this because this is not just about economic development, it's not about social inequality, but defines the kind of society that we want to have.
Thanks, Barbara. So, Jeff, let me turn to you. You come from a private sector, vertically integrated healthcare platform, and how do you see the major benefits?
Sure. So I come more from the internet digital side of the business. Interestingly, if you look at all the sectors out there, most of the major sectors have already been disrupted by whether it's internet, digitalization. Now, one of the biggest sectors that has not been disrupted fully is healthcare. And there are a number of reasons for this. Number one, I think healthcare is difficult to do. Number two, if you look at healthcare, majority of your services is still offline. As simple as you need to draw some blood, or if you think about just having influenza, can a doctor really give you 100% diagnosis just looking at you do a video online, which at the moment is still a no. And number three, because the healthcare potential consequence is life and death and not just me getting a food poison from ordering food delivery, that liability and how doctor performs tend to be a lot more conservative. So the way I see it is, in healthcare, whether you call it digital or not, without the offline piece, without that traditional clinics and services, it's really difficult to provide a seamless, integrated, end-to-end value chain or value chain type of services to users. But you can add, once you have the offline part, you can add a lot of the technology, internet digitalization to make it more effective and efficient. And it's really, for me, it's really about what we're trying to achieve really is about accessibility as well as affordability. So what that means is you're not saying, hey, I'm going to change so that you can only see doctor online, or you will only see doctor online because they will solve 100% of your issues. That's just not reality today. What I'm saying is, if you live 2 hours away in Indonesia from the city center, there's no good doctor there, there's only a bunch of village doctors, do digital consultation as an initial step. You might be able to access a better quality doctor who can give you better consultation or better assessment. And do that delivery is also cheaper, so the affordability part is also there. I like what Barbara actually mentioned, one thing relating to AI. I think AI is a big buzzword. I mean, we went from data analytics, big data to AI these past few years. I'm a big believer that AI is not going to replace doctors anytime soon. We see good AI application in image recognition, for example, on X-ray, on scans. But I see AI as more of an enabler to make the doctor more accurate, to make the doctor have less, malpractice or kind of making less mistake. But healthcare is a very personal type of service. People, when they're sick, will still want to see doctors. But with an enabler, whether it's AI or other technology tool, we can make the success rate or the quality even better. So that's how I see digital and technology applying to healthcare.
Thanks, Jeff. So, Hussein, I think that you've been working on transforming healthcare at a national level.
Yeah.
and in multiple countries, in fact. And so, your perspective.
So yeah, I mean, definitely, I'm not going to repeat what was said from the previous speaker. There's a lot of potential and benefits from using technology and digital solutions, from cost savings to better administrative processes, but potentially also better outcomes through better diagnostics, prognosis, and treatment. But not only to the point that it's curative, but also before getting to the point that you need healthcare services, digital technology will have a major role in terms of patient activation and better information, reducing the information asymmetry and better management of conditions. So there's no doubt that there will be benefits. The issue that I faced during my work is why healthcare has been such a laggard when it comes to digitization. And Professor Spence today mentioned that, the extent of digitization in the economy is different. He didn't mention healthcare, but I'm sure he was referring to healthcare as one of the laggards, because it's mainly change of mindset. And as you said, we deal with people. Healthcare is radically different from other sectors. There's a lot of emotions and empathy. Yes, IBM Watson can detect cancer, but then who will tell the patient that, you have a cancer, don't worry, we'll take care of it. There's a lot of empathy. The other thing is, in the healthcare, the processes are less specific and standardized. So there's a lot of tacit versus explicit knowledge. So how do you codify and put in numbers this knowledge? So very complicated. So also health systems are complex, and most of them are fragmented. So primary care doesn't speak to secondary care or tertiary care. There are systems that they don't have a unified healthcare record. So the patient can move from one sector to another and go through the same process again, shop for doctors without the same medical record. So it's definitely unique, and I think this is the reason why it impedes the diffusion in the health sector. So in a word, someone said that patients are not airplanes and hospitals are not production lines. So it's not very straightforward and linear. Yes, I'm going to apply technology and we'll fix my problems. No, there's never one-to-one relationship in health. One doesn't lead to 2, 3, 4, 5, 6. It can lead from 1 to 9 or even from 10. Very unpredictable. But then the prospects are very good when you see what's happening, and probably you are in that area with doctor. But big players, Google. This week, Google made 2 major announcements. They're acquiring Fitbit for $2.1 billion. And they signed an agreement with Ascension, a major provider in US, 150 hospitals, 50 centers, to become their cloud repository and data intelligence. And you had the previous examples of Apple. You have Amazon with Berkshire Hathaway establishing Haven, which will work on reducing costs and improving access. So there's a race towards digital health, and it tells you that there's a lot of potential in this area. But then you need to deal with the downsides and the difficult aspect, which is privacy, which is another topic we'll can discuss later. So it's a not very straightforward journey, but there's a huge potential and huge market that it attracts a lot of business.
So, Barbara, I'll come back. I have some questions for you before we move on to the other main side. But one of the things that you are really stressing is the paradigm change and really linking this thinking to what is probably the world's largest initiative, the SDGs, at least as a conscious social effort. In my experience, much of the thinking around the SDGs revolves around many of the things that we are discussing at the meeting today, namely equity. And I think that what was not addressed so directly are things such as governance. And yet, so do you see this shift towards digital technologies as enabling those, or do you think they actually, in a sense, almost automatically create equity by the nature of digital technology? I mean, what is the relationship?
In healthcare, if it were to be available universally, I believe that it would address the issue of poverty, hunger. It would address the issue of education, because if you're poor, you can't go and work. It would issue, decent work. But where you come in is that it actually would help to address the issue of social inclusion and gender justice. Because right now, a large segment of the people who are excluded from healthcare are actually women. So it does address all this, but the social justice and particularly gender justice and the issue of social inclusion are so complex that it's not going to be addressed by any particular one dimension. But I believe that with the digitalization into healthcare, making that more widely available and more accessible, it would address a lot of that. And I'm, of course, later prepared to deal with the downside that you would like us to deal with.
Jeff, a question I have for you is, one of the statements that you made is something I hear every once in a while, which is that this ought to be looked at as an enabler rather than a replacement. And yet, why do you think that? And are you sure about that?
Yeah, I'm saying this is because if you look at AI application, what works very well is when there's very standardized set of rules, whether that is chess, whether that is Go, where the AI can now actually be humans, because every step there's a set of number of moves that you can do. Human beings is a very dynamic thing, right? Where you live today, how you live your life, what type of family background you come from, can determine very much whether certain things works or doesn't work for you. I give you a very good example. Babylon, which I think most people would know quite well, is a very successful AI symptom checker business model. They signed a agreement with Prudential, I think last year, to roll out symptom checker in Asia, and it took them 6-9 months of localization, and I'll tell you why. Because in UK, where they are based, when they do a symptom checker, if you have a fever, they'll never ask you a question of, did you get a mosquito bite? But because in Indonesia, there's dengue, they have to localize that because that's actually one of the potential symptoms. So there's actually, so you can imagine, that's just one very simple example. Where you live, how you live, what region can have such different impact that as of today, I don't think we have seen technology where we can say AI is going to replace doctors. And second is what Hussein said very well is it's about empathy. It's about, hey, yeah, maybe Watson's can diagnose and say you have cancer, but so what's next? Do you necessarily want to something that pops out on your mobile phone says, hey, by the way, you have cancer? Okay, I think you want to talk to someone. You want to work with someone to develop a treatment plan. And again, the AI can be a more, or data analyst can be a much better enabler of this is your background, this is your race, your age. So based on data analytics, the percentage of using this type of treatment, this type of method has a higher success rate. I think so. I still do think it's an enabler rather than a replacement as of today.
Hussein, the follow-up question I wanted to ask you is that in global health, there are a large number of players, ranging from NGOs and civil society up to countries, scientific societies and so on, the economic sector. But countries are probably unique in that mix, and they have a kind of irreplaceable role, at least now. And in terms of how, in your experience, national leaders are looking at something like digital technology in health, do you see them being driven by that because changes are occurring, they need to adapt, or do you see them being more proactive and actually taking a look at how digital technology can be used in, say, Saudi Arabia in order to transform the system?
Yeah, I mean, it depends from region to region, and I guess culture plays a role. Well, I can comment on the Middle East and the countries that I worked. They're looking very much into knowledge-based economy, and technology plays a major role. They're investing heavily on different technological solutions, whether that's artificial intelligence, machine learning, other technologies. You mentioned Babylon, so the Saudi Sovereign Wealth Fund, PIF, is one of the investors of Babylon. I think they're acquiring, and other digital disruptive technologies like Uber and so on and so forth. So they're seeing technology as a major enabler to transform not only health systems, but in general the entire country, because they are seeing it as an opportunity to leapfrog from economies and societies that haven't been followed a path of development that other developed countries have done, in a way that technology will provide access to different services and information. And by the way, the penetration of internet and mobile services is amazing in these countries. They are very avid users of social media. Twitter is one of the most used platforms in that region, Snapchat, so on and so forth. So the leaders there, they see potential. They're making good use of it. They invest a lot because they're banking on the prospects that it will return. And definitely they want to modernize the society. And it's going very fast for a region that was relatively, isolated and very resistant to these changes, not only from technical and economical perspective, but also from societal perspective. I mean, until 6 months ago, ladies were not allowed to drive in Saudi Arabia, or a year ago maybe. And now, I called for an Uber a month ago or 2 months ago. No, more, 4 months ago. There was an Uber lady driver, It was remarkable, from band drivers to Uber. So there's a huge uptake of technology, and I think they're banking a lot on using technology to achieve some of their vision goals that they have put in front.
Okay, thanks. So let me push a segue into the second area, which is that because we're talking about digital technology, there are generic concerns, but there are probably also health sector specific concerns, which are just different than in other sectors. And so, besides highlighting some of those things, I think the more interesting, perhaps the most important part of the question is, what is it that we can be thinking about doing? I mean, how do we anticipate and how do we get ready to mitigate them? Barbara.
A couple of years ago, there was a front cover on Newsweek magazine, and with a robot doctor, and it says the doctor will see you now, and it's a robot doctor. And assuming that you get to let's just imagine, it's a robot doctor. You go to see him. I say him just out of custom. I see it. Anyway, the robot doctor has access to information that no human doctor can have. Within split seconds, this doctor would be able to access data from all over the world with your kind of case, and saying, this is what you would have in terms of probability, narrow it down to 1, 2, 3, whatever it is. But the whole thing is that no human can match it, because there is the networkability. If you deal with machines on information, it's updated instantly. Any doctor, any medical professional, no matter how up to date, you're not able to read all the medical journals. You're not able to find out the latest counterindication of a medication, and you could then cause harm to your patient. So I would say, you have a robot doctor. He's probably the best. But I agree with what has been said, that all these technologies will be used to complement a human being for a number of reasons. The first, which I don't quite agree, but has been said, that because a machine would lack empathy. I believe actually it can be trained to show empathy, but that's what is being used. There's always a lot of vested interest. And importantly, is the issue of liability. If something goes wrong, whom do you sue? And that's the problem that you have also with self-driving vehicles and all the other AI-related issues, which have to be addressed one day. But these are the issues. But whether you have, how far you use AI and digital technologies, there is the overwhelming issues, and this is more important in healthcare, in the healthcare sector than anywhere else, and that's data. You know, not only that we are feeding information all the time, even just by, I think, Debbie, you sent me an article in the FT where people are selling personal data just because you go to WebMD and ask questions about various things that you're using. You have wearables that, you know, is going to Apple, and I don't know what they do with my blood pressure and how many times I exercise. But we are now moving beyond this in terms of the quantified self to put sensors inside our body for health purposes. You know, you put sensor inside so that the sensor can indicate how the medication is working, how your intestines are reacting to this, and how your hearts are reacting. And that information is also being transmitted out. So the most valuable and also the most dangerous part of the healthcare sector is the human information. And that, and I think we have to deal with it because it's happening. So that's the, you know, particular case of the healthcare. It's just beyond any other areas of the sectors that use digitalization.
Jeff?
Yeah, I think Barbara hit it spot on. I was going to talk about basically data and medical liability. Because if you think about, I mean, that's a very good example. Even if you do an AI symptom triage service, then maybe they said you actually have something quite simple. You don't need to see a doctor, but ended up you have something more serious and you die. So who actually has the medical liability there? So if you look at a lot of these services, they actually put it as it's just a assessment rather than a consultation. So there's no medical liability to it. You do a teleconsultation. What does the doctor have the liability, or is it the platform that's providing the service? Whether that's a marketplace type of business model or third-party doctors or not. So who actually has that liability? Because when it comes to healthcare, again, the potential implication can be quite serious versus other type of markets. I think on the data point, I also agree very strongly in that when it comes to healthcare data, it's a lot more sensitive. It's a lot more scrutinized by the regulatory bodies, and that has to do because healthcare data is more sensitive, right? You having particular issues or you're having particular type of symptoms could be quite sensitive, and it's not as the same as, let's say, data on I just buy XYZ, online at Amazon, at Alibaba, where even if it leaks, it doesn't really matter as much. And obviously, with enough healthcare data, can it be used to attack or to do more harmful things to certain type of people or whatnot? And that is starting to think about from the national level. So if you look at Fullerton, we're in 9 different countries, and every country has such different vast way of regulating and what you can do with the data. Then it becomes, well, how do we think about managing, and how do we think about working with the data? So can we sell the data to third party? Obviously, that's a big no-no. But can we use anonymized data and work with third party, whether that is pharmaceutical company, to help enhance their R&D capability on new drugs or get to market faster? Or working with the insurance company on anonymized data to price insurance better, to price risk better? Then that is something we can start exploring without potentially have privacy issues or data leakage issues or linking back to any individuals.
Yeah, they say data is the future, the oil of the future. And I mentioned earlier, there's a big race between these technology companies and these platforms, because when you see them, they are sort of like the pipeline that is very costly with very high fixed costs, but what they miss is the oil, and the data is the oil. If the oil doesn't go through these pipelines, they are not worth anything. So that's why it's this race to acquire as many possible data-driven and data-generating systems and companies. But then the data privacy issue comes in. It's easier to acquire data than to safeguard data. So medical records are now the second highest Healthcare is the second highest targeted sector for breaches and hacking. It's even higher than banking and military and government. That in 2018 in US there were 10 million people affected. In 2015, Anthem Insurance had around 78 million people affected where there's a breach on so. And there's a reason. In black market, the credit card information, it's worth 25 cents. The social security number is 10 cents. A medical electronic health record, it can be worth up to $1,000. Simply because the electronic health record is the most comprehensive record of information, from your social security number, ID, credit card, all your history about all sorts of procedures, diseases. So there's a lot of data that you can use. So as long as this aspect of data privacy is somehow not tackled and made bulletproof from different hacking, I think it will significantly impede the diffusion of technology in healthcare. Personal information when it comes to healthcare is very sensitive, and I agree with Jeff. It's not like, I bought or I'm a member of one of the loyalty programs. The only thing that will go out my username, password, and some other credit card information. With the medical records, basically, the entire life is out and it's being abused. And this is where the regulators come in. So there's a lot of. I'll tell you something. I mean, we've had so many technology and other companies interested to partner with governments to be able to use our data, which are unified off the grid, to use them and to combine them with big data in US and to come up with some predictive analytics based on different patterns of disease, and so you can use that in different countries. But because the regulations are so tough, they don't allow the data to leave the country, even in a cloud format. Even pseudonymization or anonymization is not 100% proof, because there also is a way to triangulate. We couldn't execute so many excellent projects only because of this. Simply, you cannot convince the authorities that this data, although anonymized and pseudonymized, somehow will not be compromised and will not be utilized in a way that will affect even the national security of that country. So it's a very sensitive topic, and I think will be the single major impediment for digitalization and technology in healthcare. That's why it's one of the laggards, I have to say. Yeah.
So I have a lot of questions I could ask you, but I do want to open it up to the audience. So if you have a question, can you just quickly introduce yourself, and then if you're asking it to one person or another, just indicate, or if it's to the whole panel. Yes.
Thank you so much. That was all right. Thank you so much. That was really stimulating. My name is Anant, and I'm from India, a journalist from India. It's interesting to hear about all these amazing new things that are happening. But then I think about my country, where we have such basic issues just in terms of access. So this is a general question to any of you. So I'd like to hear a little bit about, we think of these amazing things that are happening, but can you speak a little bit about how technology could help us in a country like India address some of the most basic issues that we're facing in terms of access to healthcare?
Well, actually, I think in your country there are already some experiments going on, maybe not to the scale of We Doctor, of matching patients and doctors and providing telemedicine. But I actually think that the world, India, would actually have to be a lot more innovative. But I actually think that despite all that we have said against AI doctor, it will have to come. because right now there are over 18 million shortage of healthcare professionals, and much more millions of quasi-medical staff. So there is no other way except just to go and to go with more and more artificial intelligence and deal with the data concern.
So if I look at, actually India has some pretty interesting digital health company, right? From guys like Practo to 1MG of the world, My Health Code. Actually, there's quite a lot. Obviously, everybody's focusing on a certain part of the segment. I'm not 100% against AI. I'm not saying AI is not, but if I look at let's say the whole value chain, the 100% of it, the last 20% is probably your hospitals, right? Your critical illness and whatnot. The first 80% is your primary care, your some of the secondary care specialists that you will need. So if I were to look at that, I probably see the initial 10, 15% can be taken care of by AI as well as digital consultation. So that really solves a lot of the accessibility, right? So that happens, I mean, with what HaloDoc is doing in Indonesia is basically doing that. But rather than I sit in traffic for 2 hours within Jakarta, why don't I do a simple digital consultation? They can solve some of the simple things. The other thing I see actually, at least quite applicable to today, and that's what we do at WeDoctor and Fullerton, is maybe digital consultation is not for your, I think you have to kind of start having targets, right? Your digital consultation is not there to just solve any random initial consultations, right? Maybe it is more applicable for chronic disease management. So you have offline diagnosed that you have a certain type of chronic disease. You have to see doctor more frequently, getting refills. So you could do that much easier through digital consultation because it's low risk. You already know what you have. Or secondly, is what we do quite frequently is revisits. You see a doctor, they give you some antibiotic for 3 days, 4 days, you're still not feeling well after that. Can you do a digital consultation to revisit? So again, save you cost as well as accessibility issues. Third, that we have seen quite frequently is second opinion. What we did at WeDoctor at one point was, you could go to one of our partner clinics, and then from there you could do a digital consultation. We were partnering with Harvard Medical School where you can do with one of their specialists, and then next to you there's a primary care sitting there. So when a specialist is asking certain type of more targeted questions, the primary care doctor know what type of vital they need to check to get in order to answer, to give the doctor, that specialist on the video, a much more accurate reading of you. So I think places like India, or actually a lot of the more developing countries, can use these type of technology to make the healthcare services better.
Yeah. I mean, India is probably one of the latest countries that has pledged for universal health coverage to cover its entire population. And when you speak for, the sheer number of people that they need to cover, it definitely will be a very costly thing and probably unaffordable for the Indian economy. So India will need to build a good health at low cost model of system. And to achieve that, one advice that I would have given to the Indian policymakers is focus on primary care. Focus on primary care, build a strong primary care network. Don't jump into the trap that many countries in the past have done by building hospitals. And use technology as much as possible to lower the cost and make it more accessible. So telemedicine is one, all different sort of solutions. I mean, I found out that the payment mechanisms are now so ubiquitous in India, so the people can use all this digital platform for payments. Everyone has a mobile phone there, I think, in India almost. This is my understanding. So there is a potential that you can use technology. So and you can sort of partner with the private sector through public-private partnership, so to sort of share the cost burden, because currently the way the economy in India is performing, probably it will be a huge, significant burden to go a big bang universal health coverage in the classical way. So I agree with my colleagues that as much as possible technology usage will lower your cost and improve efficiency in the system.
We have another.
Hi, this question is for Jeff. So my name is Charleston Sin, MIT Hong Kong Innovation Loop. So now you work for We Doctor, and I'm interested to know that whether you have one or two example of We Doctor, how they innovate, create differentiation, or if We Doctor that is not convenient, you can use Good Doctor an example to show that how the Chinese consumer use case are unique and make it the possibility for digital health that it can actually advance.
So to take a step back, I think if you look at a lot of the companies that's disrupting various sectors, including healthcare, whether that's Uber, whether it's Alibaba, Tencent, most of them have not come up or created some super innovative technology that is changing the world. A lot of it is actually there, but what they did is rethink about that whole user journey and experience. So We Doctor was similarly started in 2010. When they first started, We Doctor was a little bit different. The founder, Jerry, he actually went through kind of his own medical experience with his young niece. And in two pain points, which everybody experienced in China, which is number one, finding the right doctor, and number two is accessing the right doctor. And there's a third one, which is the long wait where you wait 3 hours. They always talk about wait 3 hours and see a doctor for 3 minutes. So what he realized was, well, why is it so difficult? So the first thing he created was digital appointment, right? So he started working with hospital for free and said, let me help you build this so that people can now book appointment digitally beforehand, so they don't have to wait 4 a.m. in the morning and then wait 3 hours just to go to the appointment desk, get an appointment, and then wait another 2-3 hours to see the doctor. So there was that pain point. So it wasn't anything that was super innovative, but it was just thinking about what technologies out there, what I can use online, mobile application, so that I can make that process efficient and more effective for people.
Thank you.
I'm Victor Lee from the University of Hong Kong. So I do research in AI, and I want to explore a little bit about the liability of AI medicine. Now, of course, many of us know that many AI models are black boxes. So you put it in these data and okay, you have cancer, right? Now the problem is we need to be able to explain to the patient or to the doctor who is looking at the data, and because they're responsible for explaining to the patient why I conclude that you have cancer, right? Now, those of us in the academia, we are looking at something called explainable AI, which is, okay, the reason why I diagnose you to have cancer is because blah, 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 right? But even those studies are probabilistic. So I will say, okay, with a certain percentage, then I am 90% sure that you have this kind of cancer. Now, the question then is eventually, who is going to be liable? Whether those of us who develop the AI models or the doctors who use the AI models to tell the patient that he doesn't have cancer, but then he does, right? So I guess the question is, especially for those of you in the commercial world, right, you must be thinking about these problems. So who's going to be responsible? I talked to someone and they say, well, it has to be the human being. So do you agree with that?
Maybe I'll start first since I'm in the commercial world. Interesting enough, so I think I don't think there's a right answer. I think no one has the what's the right or wrong answer. The way we use AI, if you look at Fullerton today, the way we use AI is more for quality check. So we do it for our imaging radiology business. So once you get a scan, there will be a radiologist who check the scan to determine what is there, whether there's cancer or there's certain things. Then all the scan is feed through an AI system, and the AI system basically will pick out things to tell you may want to double check again. So it's more I say quality control, second check feature, and then it gets checked by the doctor again. I see now, I think if you were to use AI as an enabler of doctors, and ultimately it's the doctor who's making that consultation decision or that signing their name on that consultation, then the liability has to be on the doctors, right? It can't, unless unless the patient is specifically signing some consent saying, by the way, your consultation result is provided by AI and the liability is served by AI, which I don't think that would be the case anyway. So my view is it's as of today or in the near future, the liability will continue to sit with the doctor. It's just AI provide doctor with additional information to make the assessment.
I think this is as much as legalistic issue, also an ethical question, which I don't think anyone has an answer to this at this point. But what I know is because of these issues, the black box and the regulatory ambiguity, that's the main reason why AI has sort of failed in the clinical setting. Very little application, while it has been more successful in life sciences, in drug discovery. So as long as these issues are somehow not resolved, we will see more and more laggard effect into applying them in the clinical setting, which is the most sensitive part. And liability plays a role. But then in the other areas, like in life sciences, drug discovery, there haven't been issues around this, so that has been more successful. Just a brief comment.
You know, if I could just have the last word, I raise and I agree with all the legal liability issue, the data risk issue, but you know, if I were among the 3.5 billion people with no access to healthcare, and if I were among the 100 million a year who get pushed into extreme poverty because of the healthcare costs, I don't give a damn about where the liability is or what you're going to do with my data, because now it is for me a matter of life and death for me and my children. That's how I'm going to think.
Okay, I think we are given the time is up sign back there, and so I think that it'll give everybody a little bit of time to make it back down to the plenary. So first, can everyone join me in thanking the panel for a fantastic talk? Thank you, everybody.